making a sandwich for lunch.
It feels great.
A simple moment that feeds Chevy Perkins' soul.
I got a place to stay and I can call it mine.
That hasn't always been the case.
I spent a couple nights on the streets,
A loss of a job and addiction created the perfect storm.
and that led me to not have a place because my habit started to grow.
While doing drugs and dealing with chronic homelessness, the 58-year-old had an aha moment.
I either change or die. That was the bottom line that I got in my heart.
Despite getting life-saving treatment and a job, Chevy could still not find a place to call home.
There's just such a shortage of housing.
United Healthcare stepping up to help close that gap.
I would have never thought that a healthcare provider or a managed care provider would pay for housing.
Akron and Cleveland are among more than 24 cities nationwide where the company is now covering a year's worth of rent
Get out of here, you lying.
for a handful of its members like Chevy who receive Medicaid benefits.
They are big users of emergency rooms.
A chronically homeless person costs taxpayers nearly $36,000 a year.
Health is not just the absence of disease.
The National Alliance to End Homelessness says that figure is cut in half when they're placed in supportive housing.
Combining and bringing housing and health together is something that makes eminent sense for us.
That's because their upfront investment in rent significantly reduces their costs on the back end.
So we have seen dramatic reductions in the utilization of the ER and in costs related to being as an inpatient in a hospital.
Both categories trending down as these members now use their primary care providers more frequently.
Which is exactly what we want to happen.
Dr. Srinivas Miragu tells me a small percentage of top hospital users account for 30 to 40% of overall costs.
So when you bring the costs down for these individuals, it can actually lower the cost for the entire system.
While she calls this idea clever, Sharona Hoffman at Case Western's Law Medicine Center doesn't see it having a far-reaching impact.
To see tremendous cost savings, you would have to give a lot more people free housing, which gets expensive.
For now, though, Chevy Perkins, who has been clean for 3 years, is grateful for this chance to get back on his feet.
This place right here is a God-saving saint to me.